Good afternoon, and thank you for joining us for this community briefing. I also want to thank Margie Prop for providing her interpretation services once again. Our community this week remains in the red portion of our COVID-19 risk dial. This is the third week we've been there, and the number of new cases, the positivity rate, and the number of hospitalizations continue to rise rapidly in Lincoln and Lancaster County. Red is the highest portion of our dial. It indicates that the risk of the virus spreading in our community remains severe. The situation in our community is very serious. With our numbers going in the wrong direction, we need everyone to be aware that the risk of this virus spreading in our community has never been higher. Right now, it is critical that all of us who live in Lincoln and Lancaster County avoid activities outside the home unless traveling for work, school, food, medical care, or to check on others who may need assistance. Be diligent in following the 3 W's. Wear a mask, wash your hands frequently, and watch your distance, keeping at least 6 feet from others who are outside your household. Also, please be committed to avoiding the 3 C's: crowded places, confined spaces, and close contact. Health Director Pat Lopez will provide more information about the level of risk we face in just a moment. Our biggest area of concern, however, is our hospital capacity. We are seeing all-time highs in the daily number of COVID-19 patients who are hospitalized. In just over 3 weeks, Lincoln hospitals have seen the number of COVID patients more than triple, from 51 patients on October 26th to 169 patients today. This week, we again want you to hear from those on the front lines, the medical professionals who are providing direct care to those who are ill. Today we'll hear from Dr. Kevin Richmond of Nebraska Pulmonary Specialties, Dr. Joshua Miller, Emergency Medicine from Bryant Health, and Michelle Rogers from the Intensive Care Unit at CHI St. Elizabeth. And for first up, I'd like to invite Dr. Richmond.
As the mayor said, I'm Kevin Richmond. I'm a lung and ICU doctor, and obviously have been involved with this COVID pandemic kind of since the beginning. And first off, I really think I speak on behalf of our entire medical community when I want to thank the mayor and Director Lopez for your leadership in this. I mean, your navigation of a very difficult situation with a lot of difficult choices, and how you've handled that, frankly, I think has been outstanding and has saved lives. And I know the decisions being made with this are not easy. I mean, there's always a give and take, and there's going to end up being people that don't appreciate those hard choices, and they're not being taken lightly. What I'd like to say regarding this is that my group has had the opportunity really to take care of these patients across the spectrum. So we do outpatient and inpatient, including the intensive care unit. And that really allows us to see the fact that the focus had been, on mortality and the deaths from this, but it is much larger than that. I can't tell you how many patients I've seen while in the hospital and how long they're in the hospital, and the suffering that they go through, and the fighting that they put up to get through it. And luckily, most of them do get through it, but certainly not all of them. And the longer they're there and they end up on the ventilator, the mortality goes way up. And certainly there's hope. There's the monoclonal antibody that's just come out there, and a vaccine potentially on the horizon. But right now, as the mayor said, we are in a very dire straits with regards to the strain across our hospital, our healthcare system in Nebraska. Obviously, I think a large number of people listening to this press conference are from Lincoln and the Lincoln area, and this would be my plea, my call to action. We all have a role in getting through this, and I worry about our ability going forward here in the next several weeks. If we don't flatten this curve, we will overwhelm the capacity of our healthcare system, and that is frankly frightening. I've served in the military over 30 years, so I've been in a lot of difficult kind of situations, scary situations, uncertain situations, and I don't know if I've ever had something that has me so worried. A month or so ago, I had written a letter to the editor of the Lincoln Journal-Star with the help and insistence of my wife in trying to find ways to communicate, what we're talking about here. And, kind of the analogy I used, as Josh can attest to in the military, we often use this term, soft target. And so the virus looks for every opportunity to take advantage of soft targets. So when people go and gather at parties, lump together, have a disbelief in the benefits of masking, you are making yourself a soft target, and that's what the virus wants. I know as Nebraskans and certainly as, Americans, we like to fight. We like to, be in front and handle something, head on. Well, the way we fight this is by doing these things that the mayor and repeatedly over this pandemic has been brought up. It's that avoiding the crowded places, wearing the mask, washing your hands, and making those kind of good choices. And here's what I'd say. You can take the gamble that you would get it and you're not going to add to our capacity issues, but I promise you that is not the case. When you become that soft target and you have this virus, your likelihood of transmitting it, perpetuating that transmission to the point where it will reach a vulnerable person is extremely high, and especially right now when we're seeing this degree of community transmission. And so I'm standing up here, making the plea as a healthcare provider, seeing, how amazing our frontline healthcare workers are doing in both hospital systems, managing this. And I am worried, when I speak about Lincoln, but also about the entire state, I am worried about how much more we can do. And so please help us help you by following these recommendations and making these good choices. I can say that it sucks. We have Thanksgiving coming up, and as you have seen from the CDC's recent outline guidance recommendation, strong recommendation is not to travel, not to do large Thanksgiving groups, and ideally do it within your immediate household. Thanksgiving is one of my favorite holidays. I love to get together with my family, my folks, my brothers, and watch the Husker game on the day afterwards. But we made the very difficult decision not to do that because I don't want to be part of that transmission, and I don't want it to reach anybody that is going to be vulnerable. So please, I know you hear this over and over, but this is the time to act and to really follow through with the things being outlined to get this under control. And like I tell everybody, my kids, people who are suffering through this, it will end. Sometimes you just got to make some sacrifices right now so we can get through this and protect our community, protect our healthcare system, protect our healthcare workers who are just working their tails off. And honestly, you can throw all the money you want at them to do extra shifts and all that, but there is a limit, and the burnout factor is there. And so please help us get through this. Thank you.
Good afternoon. My name is Josh Miller. I work as an emergency physician at the Bryan Healthcare System, and I just want to echo Dr. Rickmuth's sentiments regarding the leadership in this city. I'd also like to echo all of the things that he said regarding the things that we can do as a community. I just want to give you a brief perspective from the emergency department and where we're at right now. I think the biggest message I can communicate is that I feel like the patients that I'm seeing in the emergency department, the people that I work with, just the general environment, it's been fatiguing to do this for so many months. When we started this, when this pandemic fell upon our nation, there was a really increased heightened sense of awareness. What you were doing, how far you were staying away from people, businesses were closing, what we did with schools. There was really a joint effort in the spring. And I didn't, from my perspective, and I think the numbers would bear this out, we didn't see as many COVID patients at that time as we're seeing right now. And so the message I would like to get out is that it's been a long time. We've been doing this for a lot of months, and the situation we have right now is much more significant and severe than it was in the spring. And so I'd implore everybody in the community to remain vigilant. I know this has been a long haul. It's been a long year. It's been tough for everybody. But we are seeing significantly more patients with COVID in the emergency department than we did in the spring. When the hospital system gets strained, the ability for me to take care of patients with strokes, with heart attacks, with trauma, with significant infections outside of COVID decreases because we will be essentially taking care of all the COVID patients in the emergency department as our hospitals become, as the patients overflow back into the emergency department. We are not at that level currently right now. The Bryan Health System, which I work with, has been exceptional at freeing up the emergency department so we can care for you with all the ailments that may come your way. But there are times in the emergency department when our ability has been stressed to carry out the normal functions of an emergency department and to care for the big influx of COVID patients. So, like I said, I would implore you to listen to all the guidance that's been out there for months now, and to take this next few weeks, especially as we come into the holidays, with as much intensity as was poured out at the beginning of this pandemic and in the spring. And I just want to thank all the coworkers that I work with, all the nurses, all the staff, the medical community in general. Lincoln has been excellent. I served in the military for the beginning part of my career. I've been in Texas, I've been in Omaha, I've been in Lincoln, and the community here has been outstanding and above par compared to all the places that I've worked. So I really want to congratulate the community that I'm working with, and I hope that we can continue to make people well, to serve them with all the excellence and diligence that we've been doing for the past several months. And the last point I'd like to make is, from an emergency department perspective, it's very difficult for patients with COVID to know, should I go to the hospital, should I not? I've been having symptoms for quite a while now, and I don't know if I would warrant assistance from being an inpatient in the hospital, or if I can handle this in a clinic or as an outpatient. And I'd just like to say we're more than happy to care for you, to evaluate you in the emergency department. However, if your symptoms seem to be mild and you are a little bit unsure, there are other avenues besides the emergency department in the city from which you can be evaluated and tested. Again, we want to preserve all the resources that we have in the emergency department for the patients that need our care the most. And I want to reiterate that we're happy to evaluate anybody who comes to our door. But I would implore people to seek some other resources in the community if you feel like your symptoms are mild and may not warrant a hospital admission. Thank you.
Good afternoon. My name is Michelle Rogers, and I'm a registered nurse at CHI Health St. Elizabeth here in Lincoln. To say this year has been a difficult year would be a gross understatement. It has been a year of struggle and heartache, ultimately a year of growth, but it's important to remember that it's not over yet. We are still in the midst of a very long and deadly pandemic due to COVID-19. In our hospital, we continue to see an increase in the number of patients we're seeing every day. Our ICU specifically is consistently seeing our beds filled day after day. With every patient we move out of our unit, it feels like there are 3 or 4 more patients waiting to get that one available bed. We're not just seeing patients from Lincoln and Lancaster County, but we are stretching and helping support health systems across our state in the Midwest region and offloading our patient overflow when we can. What we're also seeing is a rise in people who are not taking COVID-19 seriously. Seeing people in our community without masks or attending large gatherings has been incredibly disheartening to those of us who are working hard, picking up extra shifts, working overtime for months and months on end, and spending time away from our families so that we can be with yours. COVID-19 is nothing like the flu, and it's taking our community by storm. Yes, there are those that have minimal symptoms, and yes, there are those that recover. But what you don't see is what I see every day. While there are patients that recover, often their life looks drastically different after COVID-19. People are alive, but they're breathing through a trach. People are alive, but they are living in rehab and long-term care facilities. People are alive, but their lives are different, and those are the lucky ones. We also see the patients who don't get the chance to live another day outside of the hospital or see their families one last time because of COVID-19. In those moments, we as healthcare providers become their family. As a nurse, I've strived to go above and beyond to make patients' last days warm and full of love. I've printed pictures for families so I could surround patients with the faces they know and love. I've been a patient's only listening ear, the only real conversation they've had, and the only hug they get to receive. I've also been the last face a patient sees, the last hand they get to hold, and the last prayer they get to hear as they leave this earth, because a few times families are unable to be there because of COVID-19. As healthcare providers, we sacrifice our safety and our physical, mental, and emotional health to care for these patients. It is both an honor and an incredible burden. We are working creatively and tirelessly to come up with solutions to our current issues and foreseeable ones. Patients' average length of stay is longer than I've ever seen due to COVID-19. This, combined with all other patients we see, like heart attacks and strokes, has stretched us thin, and staffing has consistently been our biggest and scariest obstacle. We've been picking up extra shifts and working overtime to ensure patients get the care they need when they need it. But it's taking its toll. We are burnt out. But despite this, we continue to work our hardest and do our best because it's what our community deserves and needs. In return, all we ask is that you help a little. Benjamin Franklin stated, "An ounce of prevention is worth a pound of cure." We've seen throughout this pandemic the toll gatherings take on the rise of COVID-19 cases. It's not if you'll be affected, but when. So we have to be a community that is on the offensive, striving for prevention, because prevention is possible. As holidays near, we're all grasping for a sense of normalcy and connectedness with our loved ones. We as health care providers get the frustration. We get the heartache, the fatigue, perhaps more than most. But what we also deeply understand is the need for continued perseverance and strength of our community, especially as we begin making decisions about our holiday plans. This is a battle we can beat, but only if we're each committed to doing our part. For years, nurses have been considered the most trusted profession in our country, and this year is no exception. Please trust and hold confidence in our call to you to protect yourselves, your loved ones, and your community. Wear your masks, keep gatherings small, maintain safe distances, and wash your hands. It's that simple. Help protect us so we can best help protect you. In closing, I would like to extend a heartfelt thank you to all the healthcare providers and nurses, especially the ones on shift today, taking care of our community. Thank you.
Thank you, Ms. Rogers. Thank you, Dr. Richmond. Thank you, Dr. Miller. Thank you to all of you and all of our healthcare heroes who are providing care courageously in our community. As a community, we do have the power to support these healthcare heroes. As Michelle said, prevention is possible. The actions we take today to slow the spread of this virus, change our current situation, and protect ourselves, our loved ones, and our healthcare system, they matter. The choices we make today directly influence the ability of the virus to find those soft targets, to spread, and to therefore determine the number of COVID-19 patients and hospitalizations that our doctors and nurses will be tending to in the next few weeks. The next few weeks are critical, but today matters. Do not wait to act. We had 2 additional deaths reported today. Since Sunday, we have lost 8 members of our community to COVID-19. That brings the total number of local deaths to 66. And on behalf of our city, I offer condolences to all of their loved ones and friends. Director Lopez, I'll turn it over to you.
Thank you, Mayor. The rapid increase in new cases continues to be a major concern. Today, another 184 community members have tested positive for the virus, bringing our total to 14,006 residents in our community. Last week, we had 1,721 new cases reported, a new record high and almost double the number of cases just 3 weeks ago at 890. So far this week, we have had 1,337 new cases reported. This is more than double the number of cases just 3 weeks ago. The 7-day rolling average of new cases shows the rapid rise in cases. The average number of new daily cases has increased 145% in just 3 weeks, from 104 on October 28th to 255 on November 17th. Our weekly positivity rate also continues to be extremely high, indicating wide community spread. The rate has more than doubled from 13.3% the week ending October 24th to 29.1% the week ending November 14th. So far this week, we are at 28.4%. We are very concerned that the spike in new cases will increase hospitalizations in the next few weeks. On this chart, the orange line represents the 7-day rolling average of new cases. The purple line represents the 7-day rolling average of hospitalizations in Lincoln. It does not appear that we have peaked in the number of new cases of our hospital or hospitalizations. Experience tells us that the high number of new cases we see today will impact our hospitals in 10 to 14 days. The 169 COVID patients hospitalized today include 65 from Lancaster County and 104 from other communities, with 18 on ventilators. We also continue to be concerned about the age of the individuals now testing positive. For the week ending November 14th, 237 new cases were individuals aged 60 and older. We know that older individuals are at higher risk for complications from COVID that can lead to hospitalization. At the other end of the age spectrum, young people do appear to be less likely than adults to suffer severe complications, according to CDC. The greater concern is that young people can carry the virus and pass it on to others. Locally, we have identified COVID-19 cases associated with youth sports, including baseball, basketball, football, hockey, soccer, softball, and volleyball. This includes both school-sponsored athletics and private club teams. Those who became ill often spread it to other players, coaches, parents, and siblings, friends, and extended family. Other local health departments in the state report similar experiences with the spread of COVID-19 related to youth sports. As part of the directed health measure changes that took effect Monday, we put a pause in indoor youth sports until December 7th. In doing so, our hope was that residents would use these few weeks to work on ways to more safely resume youth sports. Many did just that. The health department has had multiple Zoom calls with high school athletic directors and administrators, and we have heard from coaches, club directors, and parents who are all gathering information to work on solutions. Tough decisions are happening all over the country right now as we reach this critical point in this long pandemic. As we've learned, our situation can change rapidly. In the past, we have been able to give residents a few days to adjust to new restrictions before they have taken effect. We may no longer have that option. As we continue to look at potential measures to slow the spread of the virus, we need the public to understand that further steps may need to be taken early next week, and those changes may need to be implemented very quickly to protect our community and our health system. Our staff are committed to finding solutions that will help reduce the spread of COVID-19 in the community, keep schools open, prevent our hospitals from being overwhelmed, and ensure the health and safety of all our residents. We will continue to review potential measures, and any changes will be similar to what the governor has put forward for when COVID-19 patients make up 25% of all those hospitalized statewide. Thank you again to the majority of our residents who are doing the right thing, consistently wearing your mask, staying at least 6 feet from others, and limiting time with those outside of their households. These are simple but effective actions that all of us can take to turn our numbers around, to keep our businesses open and our schools open, and to support our courageous health professionals.
Thank you, Director Lopez. As the director mentioned, we are working closely with schools and private sports organizations to strategize and explore options for how teams may be able to re-engage in activities after the 3-week postponement implemented on Monday. We are grateful to those stakeholders that have contacted the health department to engage in productive conversation about how to make that happen safely. With Lincoln and Lancaster County now experiencing this degree of rapid community spread, we are left with very blunt instruments to address the dire circumstances our hospitals are facing in this moment. Throughout this pandemic, we have done our best to preserve as many activities in our community by providing information about best practices and behavior modification to keep all of our residents safe. We understand the ramifications of the options left at this point in the outbreak, and they are as distressing to us as they are to you. We know athletes and families are disappointed that they can't play until December 7th. I understand this in my role as mayor and in my role as a mother of 3 children. There is a Lincoln High School yearbook sitting on my coffee table at home with no signatures in it. It's there because my oldest daughter and her classmates had to give up the last semester of their senior year to protect our community. No prom, no senior rituals, no hugs goodbye, and certainly no signing yearbooks. So I truly understand how hard this has been for our community's children and families. I'm living this too, and I feel the losses and I share your grief. But with schools out of session all next week, we are literally asking athletes and families to wait 5 more school days, to not find alternatives that skirt around the measures, but instead make plans for how they might safely re-engage in activities after the postponement. Here to talk more about how to use the delay time productively and wisely, and how youth sports supporters can contribute to our success as a community is Pete Ferguson. Pete wears many hats and provides leadership in Lincoln in countless ways. One of the roles he is most passionate about is that of coach and mentor to youth. Pete convenes and represents a collaborative group of organizations who, at the core, work to ensure that youth development occurs both on and off the field of play. He takes a holistic approach to youth sports, and I've been witness to how he cultivates his players' strength, skill, compassion, and character. Pete, thank you for your leadership and for joining us here today via Zoom. Over to you.
Well, thank you very much, Mayor. And first off, I just want to thank you and Director Pat Lopez for your leadership. We want you to know that it does not go unnoticed during these times. And again, just appreciate your courageous leadership. As the mayor said, my name is Pete Ferguson. I'm here representing the Ubuntu Female Basketball Organization and my personal involvement for 20 plus years with varying levels of youth sports. I'm also a parent of a now college athlete whose season is on hold due to COVID. I, like you, know that many have different feelings about the virus. I'm fortunate to have the opportunity to facilitate an organization and opportunities within and outside of it for those that are in 3rd through 8th grade. Every winter, those efforts center around one of my greatest passions, and that's the game of basketball. Now, this has not been done in isolation. I'm not the only one who facilitates this. I've been blessed to have the good fortune to be aligned with a diverse array of coaches who are both parents and many who just volunteer their time and they're not. It's also been a partnership with a facility that we utilize as our home, the Lincoln Sports Foundation. I've been fortunate enough to have that collaboration and that relationship because they share a like philosophy that youth development has to be more than about what happens on the court. It has to be about scholar development as an athlete and as a person, not only on, but off the field or court of play. Many of us are making efforts during this time, and I won't say sacrifices, we're making efforts and we're making investments to align and be intentional and place emphasis on those things that are impacting us and to slow the curve. And what we need to do and what we understand is that this is all going to be bigger than any final score. I've been blessed to be supported by families, many of whom have placed their trust in their health and their scholars' well-being. And they've given us their most prized possession, and that's their scholar. And I know that as coaches and as youth sports organizations, we can't take that lightly. It has been these families that I've seen who have been directly touched by COVID, whether it's been a loss of time due to being quarantined, whether they've not been able to have loved ones who've come to every game in their entire career come and support them, whether they've not been able to attend school. Even some who've had to make the tough decision not to be able to participate because of the potential impact that it could have on their family. Now, with all that said, every time I've talked to them, they realize that it's bigger than the final score. It's been hard for scholars and it's been hard for us as a community without question. Hey, we're Nebraska, we're Huskers, what do? We compete. The mayor, Director Lopez, Ben Davey, and many others, I know you have not taken these decisions lightly. Like them and like many other coaches, we have lost countless hours and had sleepless nights about what the best decision is. Do we play, travel, or suspend things? That said, the right thing is to not do what we had been doing. That said, the time of this challenge has provided an opportunity for us to answer, as the doctor said earlier, a call to action. And I've been appreciative to be able to do that with collaborative partners like the Timberwolves Basketball Organization, Cornhuskers Shooting Stars, FC Lincoln Soccer Club, and the Lincoln Sports Foundation, who have taken it personal to practice what we preach, something that we ask that everybody does. Not only to show our support, but to invest, take ownership in protecting teammates, parents, in-laws, friends, coworkers, but more importantly, the greater community. Our scholars since the beginning of the season have been required, and not only just required, but they've embraced whether on or off the court and in competition to practice the 3 C's and the W's, wear masks, observe physical distancing, and sanitize. We stress to the scholars to hold off when reviewing, to hold off on different things that are not in line with everything else till when it's safe to play. And we said it's not about what they didn't do or what they did wrong, but that we need to collectively as a group do what's right to be part of the solution. They have taken the initiative with an idea put forward by Jamie Hahn of the Timberwolves and executed through collaborative efforts, as those mentioned earlier, to utilize the Lincoln Sports Foundation and recognize that now is the time for us to collectively rally. I really do get it. We may be on different teams and we may have different organizations, but our game plan right now can't be different. It really does have to be the same, as the mayor stressed and Director Lopez has stressed. We need to be a team player, whether a player, a coach, organization, independent, or an organization director. We each have to do our part. Just like this summer, we will continue to challenge those in the community to make the right decision. We'll challenge you to make and seek opportunities that will support physical and mental growth while leading by example. There are numerous options. There's virtual options. There's working out virtually with a friend, finding those external opportunities. Parents, I hate to say it, this might be a great time to go ahead and pull out that old video of your high school playing days when the shorts were way too short and do an X&O film study. But many in the community have stressed that we want scholars back on the court. I agree, so do I. But trust me, we can't wait, because if sports are back on the court and we are cheering, it will mean that we slowed the curve. And that's not just a victory for our scholars, but for our healthcare workers, our essential workers, our grandparents, our schools, and so many more. We all win if we can team up against COVID. We really do. Our community knows what it means to be a great teammate. It's bigger than any road trip, tournament, open gym, or league right now. But now has got to be the time that we show it. I can ask, but the scholars and families with the Ubuntu, Timberwolves, Cornhusker Shooting Stars, FC Lincoln, and the Lincoln Sports Foundation will make a much stronger ask. So I'm appreciative of the time, Mayor, but I'll go ahead and let them do that with a PSA that they've created.
We love the sport basketball,
Soccer,
basketball, tennis,
basketball,
volleyball,
basketball.
But right now, not playing is bigger than the final score.
We're going to try that one more time because it's really worth seeing. This PSA was put together by the Clay and Pete's organizations. Here we go.
We love the sport basketball,
Soccer,
basketball, tennis,
basketball, volleyball, basketball.
But right now, not playing is bigger than the final score.
Wear a mask,
Watch your distance.
Wash your hands frequently.
to help slow the curve, avoid the 3 C's, confined spaces,
Close contact with others.
cut spaces.
Do this so we can get back into the game.
Thank you, Pete, and thank you to your scholar athletes for leading by example. We are grateful to you and all of our youth sports families for your efforts to be part of the solution, and I know it's hard. We ask everyone to join together in this shared effort as we celebrate Thanksgiving next week. It's in our nature to want to be together, and especially during the holiday season. But now is the time to show your love and your care for one another by not gathering. To this end, all large indoor and outdoor gatherings, including large family gatherings, are highly discouraged. In fact, the CDC recommends that we celebrate Thanksgiving only with those in our household, that is the safest way to celebrate and show our gratitude. But if you do decide to have a small gathering, we urge you to hold it outdoors, if possible. Indoor spaces should allow for at least 6 feet of distancing at all times and proper ventilation. Guests should not share food or utensils and should wear masks except when eating, and the host should disinfect all surfaces frequently. This virus has demanded great efforts from our community for what feels like an eternity. This week, however, we are thankful for the news of 2 potential vaccines that provide hope on the horizon. What's important to realize in this critical moment is that it won't be like this forever. In fact, we can all be more confident of that than ever before. But in the meantime, we need to remain strong and do the right thing right now to protect ourselves, our loved ones, and our neighbors. Please be part of the solution, and please help us. And with that, we'll open it up for questions.
Mayor Riley Johnson from the Journal-Star.
Hi, Riley.
Hi, Mayor. Just to make it a little more crystal clear, what's on the table for further restrictions next week, and what will be the, I guess, decision points or data points that you key on to make those decisions? Are we talking about shutting down bars?
I think what you would look at is the governor's matrix for when the hospitals have reached 25% of COVID patients in the hospital statewide. A lot of those measures are what we're taking a look at right now, related to gatherings, to bars, to restaurants, to sports, to gyms and fitness centers. We don't have many good options left at this point, and that's why we're asking for the public's health. It is a lot easier to wear a mask than it is to close a business. Please help us keep things open. Please help us protect our schools.
From the Voice News in Hickman.
Hi.
We've had at least one complaint about the lack of mask wearing in the community of Hickman. Have you guys received any complaints from Hickman, Waverly, or surrounding rural communities regarding mask wearing? And have any enforcement methods been utilized in Hickman or Waverly?
I'll just lay a little groundwork for Director Lopez to say that our first approach is always education, because so many people want to do the right thing and not everyone knows how to do the right thing. We've been trying to get the message out through multiple channels, through multiple trusted figures and leaders in our community, but it doesn't mean that we reach everyone. We know that we need to educate and inform so that people can make the right choices, and most people want to make those right choices. But for your other questions, I'll ask Director Lopez to address.
Yes, we have received complaints. I'm not at liberty to really say right now. But as the mayor said, we do first reach out and do education, and we're in the process of doing some investigations, and we can update you when we're through that process.
Director Lopez, before you leave, this is Brent with Channel 8. And you just touched on it, or the mayor did. But you said throughout this, it's kind of been the policy, or at least the preference of the health department to provide education over citations or other punishments for businesses that violate the health rules. But, with the rising caseloads, is that still the case, or do you think that, stricter enforcement is going to become necessary?
We do first do education a couple times, and then there's a warning process. We have a whole process that we work through with law and with police, and we do issue citations when necessary. We try the first process, and we do meet with owners before the final process is completed.
As part of your talks with owners, have you recommended to them not to escalate things to the point of physically removing someone from a business for violating health measures?
Absolutely. We don't expect an owner to have to be in that position. So we do recommend that whenever possible. And I guess the other thing is we need people who are entering into businesses to follow what the measures are there and not put owners in that position.
So I guess with that said, you announced today the criminal complaint against the Grove related to their concert earlier this month. And we spoke with the owners, and they said the same thing, that they had been instructed not to physically remove customers. And we know LPD was present that night. So I guess the question is, if you're instructing owners not to remove people, and the health department or the city through LPD won't do it, is it fair to punish the business if they really have no option? It just kind of seems like a lose-lose situation for the business.
I'll let our city attorney talk to you, but I just want to make one point. To have an event of that size, there is an event plan that's put in place, and it is expected that the business will follow that event plan. And in this situation, that did not occur. So I'll ask our city attorney to speak.
Good afternoon. I would just say that, just to start off, that I think that these are difficult decisions, and the deciding how to work through this is difficult for all of us. I think the situation, when you talk about businesses, it's important to remember that these are the measures that we have in place. It's also important to remember that the health department before this has been responsible for regulating businesses in some fashion, whether it's through the food code or other regulations that are required for businesses. And so I think it's important to remember that regulation was in place before all of this.
I guess what should a business do in a situation like that? If you've got hundreds of people in a venue, and there's always the risk that if you just say pull the plug on a concert like that, things could get violent. But if there's always the risk that that's going to be, I think Director Lopez called it a potential super spreader. At some point, do you just have to pull the plug and rely on police to keep the peace in order to prevent the spread?
Well, I don't know. When you say keep the peace and the spread, I don't know that it was that we were worried about keeping the peace. But I would say, I think all along we've been asking people not to gather in groups, hundreds of people together. And I think my first response would be to remember that. The other thing that I would point out is that these businesses or any event, they've submitted plans, and they are supposed to have things in place to make sure that the DHMs, the directed health measures, are followed. So.
Riley Johnson with the Journal Star with contact tracing questions for Director Lopez.
We'll get to that in just a moment, Riley. I just wanted to follow on with this. Our law enforcement professionals have had a heck of a year, and they are working so hard. They, while many people have stayed at home to stay safe, have not had the luxury of doing so. They've suited up, they've stepped up, they've showed up, and they're protecting the safety of our community. Why would anyone want to get in their face or try to make their jobs more difficult during this year? The police are willing to enforce these laws. That is not the issue. But we need the cooperation of the public. We don't want to put their safety at risk, the public's or our police officers. We need everybody to cooperate. And frankly, I don't believe they were called to the Royal Grove on behalf of an enforcement complaint. They were there in their normal course of duties because we've had a lot of issues at that site in the past regarding gun violence outside. So it wasn't that they were in any way lax in enforcement. Just please don't put our police in that position. Do the right thing. Observe the measures, wear a mask, protect each other, and protect our first responders. They're here to protect us, but we don't need to put them at greater risk. Contact tracing question coming up.
Hi, Director.
Hi, Riley.
Hi. So first, with respect to the Royal Grove, have your contact tracers tied back any cases to this point to that November 7th concert?
Riley, we're still working on that. We have few situations under investigation right now.
Second question related to contact tracing overall. At the governor's press conference this afternoon, he discussed sort of the backlog in state contact tracing writ large. How are your contact tracers doing in getting to their investigations, and have they had to curtail some of their work and prioritize some level that's less than what they were doing when cases were lower?
Riley, we haven't changed anything, and we're still, in some situations, it might be 48 hours before we can reach someone, but we still strive for that 24 hours once we receive a positive case and disseminate that. I do want to say we do not use the state contact tracers in Lancaster County. We've been really fortunate to develop a very strong cadre of contact tracers that we can use because we've had a tremendous community response. We even actually have a lot of nurses that work other jobs that come in and help us when they are available on weekends and in the evening. So we continue to follow our same course and work through that. What we really need people to do is respond when we call and to provide us the information we need so we can slow the spread.
Another follow-up related to contact tracing. What data did your staff have with respect to outbreaks or clusters of cases among youth sports teams? And was the policy decision on the youth sports sort of pause, was it based off of specific outbreaks or the potential spread surrounding upcoming sports?
It was all of those things. We looked at what was happening. You know, our goal has always been, as you know, to keep our students in school. We looked at what was happening in the community. We studied what had happened across the nation and learned from it, as we always do. We talked to some of our national experts and our own state experts in looking at what we could do to slow the spread and prevent it. And as I shared, where we had seen cases, that was why we made the decision to postpone winter sports or youth sports for three weeks.
And what kind of numbers are we talking about there in terms of cases?
All right. Yeah, I'm sorry, I don't know that right off my head, the top of my head, but I think rather than just focusing on numbers, what we're trying to do is really focus on some of the gathering events. I know there will be no gatherings in the rail yard this weekend. We are looking at other ways to reduce that. So I think we really need to focus on what we're trying to prevent. As you heard from our esteemed nurse here today, you know, it's really the ounce of prevention is worth a pound of cure. So that's what we're focusing on. We want to keep people out of the hospital.
I have another question for Director Lopez. This is Kale with the Voice News. Who is enforcing the health department's guidelines and mandates outside the city limits of Lincoln? And what kind of gauge do you have on the number of cases in the rural communities within Lancaster County?
You know, I'd have to go back and look at the address. I think you can see on our map, we have a zip code map on our website. I look at our community as a whole community, so I tend not to separate out Lincoln from Lancaster County. We really have only, I can say this to my knowledge, as the best of my knowledge right now, we've only had one complaint from one rural area.
That was an area that was between Waverly and Hickman, one of those two areas you said?
Yes.
Okay.
Sure.
Any further questions?
Mayor, this is Bill with 1011. I had to step out for just a minute, so I apologize if this has already been asked. We've kind of heard from the state level that there's a little bit of a magic number of hospitalizations of when we're getting into bad territory. Is there a number in Lincoln of when we're probably at a point where we're out of beds, so to speak?
We've been working through trying to identify what beds ought to be counted, what beds are being counted in that state number, because we know that some of the, in the initial stages of the pandemic, when we weren't as clear on whether or not children were being affected in the same rates as adults, pediatric beds and NICU beds were counted, and we think that those are probably not as appropriate for our count at this time. I'll let Director Lopez come speak more about the conversations she's having with our hospital leaders, but those conversations are robust and ongoing.
Good afternoon, Bill. We do meet with our hospitals, both Bryan and CHI and Lincoln Surgical Hospital, 2 or 3 times a week and daily if need be. We've been really closely looking at all the beds, as the mayor spoke, trying to count. What we're really looking at is our acute care, our ICU, progressive med surge, and so we do have that number. We also know what our hospitals can flex into. We have a surge plan that we're looking at here, but the governor has one number overall statewide, that 1170 number, but we're also looking here in Lincoln, what is our number based on our bed availability. So we're in the process of really clarifying that with them, but the basic availability, without going into more of the surge, is around 436. But I'll tell you something. One of our health directors today spoke from North Platte when I was talking with her. They have more ventilators available at their hospital, but they have no rooms or no people to operate the ventilators. So those are some of the situations that we're seeing. And even if our hospitals go into surge and they convert flexibly like PEDS rooms or psych areas, we still have to have the staff to take care of those individuals. So I'm really proud of our community, our health systems, because they have pulled together, they're helping each other, they're sharing resources together, because they're really more concerned about taking care of the people than about where the rest of it comes from.
And so just to clarify, there are 436 acute beds spread across Lincoln hospitals that could potentially care for COVID patients, just total, that's the sum of the whole?
Right. But remember, when we say 400, we have those beds available, but those are the same beds that are taking care of people who've had a heart attack, who've been in an accident, who've had a stroke. So we're looking at all of those beds from that perspective. So that's how we're measuring where our percent is in the community. But we're still in the process of developing that and clarifying what number that the governor is using for his 25%.
And so just some rough math then, right now with 169 COVID patients of the 436, about 40% of acute care beds in Lincoln are being used right now by COVID patients?
Yeah, rough math, right. That's why I said today that we are looking at, we're analyzing that and where our cases are, our case rate going up. We had the single highest number of positive cases at 408 this week. We had over 300 cases yesterday. So that trajectory in 2 weeks, if we look at it, where that's going to end up, there's a scientific basis that we know when we have a spike in cases, we're going to have a spike in hospital admission. So yes, you're right. That's what we're looking at. That's why the mayor said we're going to have to use all of those really blunt instruments going forward.
Thank you, Director.
Uh-huh.
Any further questions for any of the professionals who are here with us today, or for myself or Director Lopez? If not, I want to thank all of our guests today, thank them for being so courageous in this fight against COVID-19, for making the sacrifices and heroic efforts that they're making to take care of our community members and people beyond our community. And please heed their call. Please be a part of the solution. Please help prevent people from getting to their care. Wear a mask, wash your hands, watch your distance, avoid gatherings. Celebrate Thanksgiving differently this year, knowing that you are doing something that you can look at as a sacrifice, but the root word of sacrifice is sacred. There is a sacredness to that sacrifice. Please join us in making it. Thank you.